Yes, it's me. It's my Saturday soundtrack and you're listening to Sheffield Hospital Radio. And as I said, I'm joined by two guests this morning. We had Amanda on from our A&E department a few weeks ago, but today we've got Sarah and Chrissy. Hi both.
Good morning.
Good morning.
So tell us a bit about yourselves and your roles. So Sarah, you're matron in A&E.
I am. I'm the matron for A&E over at the Northern General. I've been there, I've been within the care group coming up to 3 years now, and I've been matron for A&E for about a year, and I absolutely love my job. I love being a nurse.
Brilliant, and we'll hear a bit more about that. And Chrissy?
So I started in A&E in 2001. I am the mother of ED. I started as a Band 2 support worker and worked my way up through the roles.
Fantastic. Well, we want to hear definitely about your different roles in A&E, and we're going to hear about some of the projects that you've been doing for hearing impaired, homeless people, and some of the support that you give to some of our patients that come with learning disabilities.
Yes.
So, brilliant. So don't worry, but first we're going to have a song. And Sarah, I think you've picked this song. Do you want to tell us what it is and why?
It's Womack and Womack, Teardrops, and it's my favourite song ever, and I've got many a happy memory of dancing around to this.
Womack and Womack there. The choice of Sarah, who's the matron from A&E. I've got Sarah and Chrissy with me. So we had Amanda on a few weeks back who was telling us just how busy A&E is, the kind of 350 to 380 patients that we get every day, and what a rewarding environment it is to work in. So Sarah, tell us a bit about what's it like being matron in A&E and what do you enjoy about your job?
So being matron in A&E is one of the most crazy experiences I've ever had in my working career, but it is the most rewarding job I've ever done. I think what I love about each of my working day is every day is completely different, and I see things, I hear things that I never thought I would ever get to do. I work with some amazing people, and I have such a good time at work with the people that I work with and with the patients. My favourite part of the day is first thing in the morning, doing the walk round with the nurse in charge, walking around the teams, walking around the department. I feel really proud when I walk round. I love getting to know the staff, and I feel that's one of my strengths as the matron there, that I do know all my team members. I love checking in with them and feeding back about the great patient care that they're providing. We've had such a really busy time recently, but the staff work so hard under extreme difficult circumstances, and the things that they do on a daily basis just amazes me. There are operational parts to my job that I have to do, but just being there and being in the department is literally my favourite bit, and I just love seeing what goes off. I get stuck in. I'm very often see me doing portering, I'll be bed washing, the tea lady, and I just love having that flexibility as the matron to be able to just get in and get done what needs doing.
Wow, so sounds really busy, really lots of different roles. Chrissy, what about you? You say you've worked there since 2001. What's kept you at in the A&E department all these years?
So I think for me, it's every single day is different. You've got staff needs that you have to answer to every single day. My job role is different every day. So one day I'll be streaming at the front desk, directing people to GP Club, walking centre, eye clinic. We can direct them anywhere if they don't need to be in A&E. The next day I might be going on YAS, which is directing people where they need to be in the department. They might need to be in resource. They might need to be in the waiting room. They can still go down to GP Club. So it's thinking about that the volume of numbers coming in A&E and do they really need to be in A&E? And then I'll take charge of the department, which gives me great pleasure and satisfaction, and that's all about supporting the staff and going around making sure they're all right. My first check of the night or day is making sure my staff are all right, because if my staff are all right, my patients are going to be happy.
And you both talk a lot there about staff and looking after staff. I presume it's a really close team then in A&E because of the types of work that you do and the challenges that you get. It's really important that you work so closely together.
I think it is absolutely, it's so important. And I think Chrissy's described it really well, that if our teams are happy and feel well supported, then they are going to provide excellent patient care, which is ultimately what we want. But we also want staff to feel safe. We want them to feel supported. We want them to feel happy in their workplace and enjoy coming to work. And our team isn't just the nursing team. We work closely with the porters, with the medical team, with our domestics, the mental health team, our clerical colleagues. So I do feel we are one big family, aren't we? And our role is to ensure that everybody is all working together, and that we're providing those environments where people feel that they can speak up, they can let us know if things aren't going quite so well, and being able to be open and honest with us about what's actually going off in the department, so that we can help either change things or improve things or give context to maybe what's happening behind the scenes that they're not aware of. Yeah, staff wellbeing to us is huge, isn't it?
Yeah. And obviously an A&E department's 24 hours a day. You're obviously not there 24 hours a day. So how's that work? You're both leaders in the department. How do you manage that unit over 24 hours, 7 days a week, 365 days a year?
So we have a band 7 in charge on nights for seniority, and on days we have SLOD, which is senior lead of the day. Which is Sarah or Jane or Jimmy or someone taking the lead that way. So there's always someone to go to.
Gosh.
There's always someone there.
Yeah, and I think obviously it is a very busy department, and we do have to have that level of seniority 24 hours a day. We don't shut our doors. But I think because we all have the same leadership mindset, that breeds and feeds down throughout the team. So my nurse director, who is Jimmy, and our deputy nurse director Jane, we all have the same leadership qualities and values, and I think I role model those within my team, and my team then role model those down within the Band 6 leadership team as well. And I think that's one of our strengths within our team, that we all foster those same cultures and qualities that we want, and expectations as well, so about what standards we want, so that when staff are on shift, regardless of who's on duty, they're aware of what they can expect from us, but also what we expect from them within the...
And I get the sense you're both quite calm, relaxed individuals. I imagine the A&E department is quite stressful at times, it can get very, very busy, but you definitely both have a sense of calm about you. I presume that's quite important from a leadership perspective.
Yeah,
Would that be fair? I
think you need a lot of de-escalation skills, certainly in A&E at times, and that's basically what you need, I think.
Yeah.
And lead by example.
Yeah.
Absolutely, it is. Well, most of the time it is very busy, it's very stressful. There can be also multiple pressures from us as a senior leadership team, not only from the patients coming through the front door, but throughout the rest of the organisation. And we've got competing priorities as to what is important. But I think if we were running around like headless chickens and allowing that to influence our behaviours, then it gives unrest throughout the department. But I think as well it is also important to recognise that we can be authentic, and sometimes particularly if I'm going around the teams, I think it is important to share that you are feeling that pressure and you are feeling stressed as well, so that the staff on the shop floor can see that it is okay to say, I'm finding it really busy, or I'm feeling overwhelmed, because it can be overwhelming, and I think it is important to acknowledge that, so that particularly our junior team aren't feeling that they have to, pretend that everything's okay when it's not okay, because there are very difficult shifts, aren't they, and difficult challenges, and I think they need to see that from the leadership team.
Fantastic. Well, love to hear a bit more about that, but let's have another song, and this song is from Amanda's emailed in. Amanda was the sister that came on a few weeks ago. Sarah, do you want to introduce what song she's asked for?
I'd love to, because I thoroughly enjoyed Amanda's interview. David Guetta featuring Sia Titanium.
And is this a song that you play when you go for your nights out or have in the staff room?
Again, I've had many a beverage to this song, so it's one of my favourites too.
Titanium there, David Guetta. So you join me, it's Michael, it's my Saturday soundtrack, and I've got two guests this morning, Sarah and Chrissy from A&E, and they were just telling me while that song was on, Sarah, you've nominated Chrissy for one of the Trust awards, Proud Awards.
I have, because Chrissy, she does so much for our department, in and out of work time, and I thought what an amazing opportunity to be able to nominate her for one of the Proud Thank You Awards, which is Excellence in Patient Care. She has been shortlisted, and I am 100% confident that she is going to absolutely bag this award come April, but I will let her tell you all about the amazing projects that she's been doing to warrant this nomination and shortlisting.
Wow, that sounds amazing. So tell us about this work then, Chrissy. So I understand it's around it's supporting patients with hearing impairment.
Yes, it's called the Deaf Awareness Project. I introduced this project in COVID, and it was to put deaf stickers on masks, because obviously deaf people lip read. It's really difficult for them when they've got a mask on.
And when you say mask, Chrissy, just so that we're kind of painting a picture, so this is the kind of surgical masks that, do all staff still wear these now in the department?
No, I'm talking about when it first started in COVID. I fetched it in COVID.
Right. And all staff were wearing masks?
They were wearing masks.
Right.
And obviously the deaf patients that were coming through, and hard of hearing patients as well, and we were putting a sticker on which allowed the patient to stand 2 foot away from us, or we stood 2 foot away from them, so that they could lip read.
And what did the sticker say?
It was just a hearing with a line through a deaf sticker.
Right, yep.
Just so that staff were aware of their needs. So the sticker project went trust-wide to every single department at the Northern General, I think, and the Hallamshire. It was really good when COVID was in. I've now updated the project to lanyards.
Right.
So what the lanyards give, they tell our staff, so it's staff awareness, and they can go onto their mobile phone, and there's an app called Convo UK, which gives the sign language interpreter on the dot for triage, for nursing assessments, and for doctor assessments. It's absolutely fantastic.
So just so I understand that then, so all staff in the department wear this sticker on their badge, on their lanyard, do they?
No, I've produced lanyards for the patients.
Okay.
So on reception, when they book in, if they're hard of hearing or they're hearing impaired, they get a lanyard.
Right, okay.
You know, this is not about labelling people.
No.
This is about what we can give to them.
Yeah, that's
from
fantastic.
That lanyard. A lot of people miss the place in the queue.
Yeah.
The doctors are vigilant. They go out, shout the name, and they can visibly see the lanyard.
That's brilliant. And then that gives you also access to an app to get a sign language interpreter live visits the department, or online?
Online.
Right.
Online. So it goes through the Trust intranet.
Yeah.
And you click on it for STH, NGH, and it gives it you there and then.
And that must be amazing then. That must
absolutely
just
amazing.
Improve communication and engagement for those patients that are coming through the department.
Absolutely amazing.
And what's the feedback you've got from staff and patients around?
They're overwhelmed. They're just, they're so happy. When I'm on shift, they'll come and get me.
Right.
I'll show them how to use it. It's quite easy anyway. But the feedback from the patients, I've got a little forum of deaf patients. There's only 4 in the forum, and they're guiding me through this.
Oh, okay. So you're getting feedback from them about what's important. And so what kind of feedback have you got? How are they guiding you?
Just saying that the project's really good. They've never had anything like this before. So one gentleman refused to put one on, and he missed his place in the queue.
Right.
So he got called 3 times and missed his place.
Gosh.
Obviously, when I spoke to him, the second time that he came, he was so grateful that this lanyard was available, and he got seen on, in time order and at his time.
Yeah, that's fantastic. And so kind of are there any plans to roll this out further within the organisation?
Yes, I've got a meeting on Tuesday
Right.
with some people from the trust, and hopefully we're going to roll it out.
And so that then would be available for all patients, because I presume similar things you're kind of describing, the problems of missing being called in the waiting room. I presume that applies across outpatient departments in the trust and in the community. And that's fantastic.
Yeah. So there's also Relay. It's called Relay UK. So this lanyard gives you access to Relay UK, which is, so if you go to an outpatient department and they want to call you back, or if A&E wants to call you back for anything, if there's something on the X-ray, it goes through to Relay UK. An operator answers the phone, and she'll actually text the deaf person and say, you need to come back to A&E, your appointment's such and such. That sends a text message to the deaf person, and then the deaf person can text back and tell us what they've said.
Right.
Which is really, really good.
Brilliant. And you must feel really proud having rolled it out. It sounds like it's made quite a difference for the department.
Yeah, I feel very, very passionate about it.
Yeah.
Very passionate.
Yeah. And how's it gone down elsewhere in the department, Sarah?
I think it's been absolutely brilliant, and I think the education for the nurses, again, it's something else that they can utilise throughout their nursing career to be able to help support patients, even if they decide that they don't want to stay in A&E. Some of our staff get moved to other areas, so they can also use that knowledge and experience to be able to support patients throughout the trust. And staff love learning. They love being able to obtain new skills and get knowledge, and again, this is something else that they've been able to embrace, and Chrissy is so passionate about it, and people feed off that passion. It's just infective across the department.
And we've heard, and we'll hear a bit later, it sounds like that kind of infection's probably the wrong word, but the kind of the
I can't think of word.
No, but I'm thinking as I say now, but kind of how that's built and how's that rolled out elsewhere. Really keen to hear about some of the other projects you've done, but let's have another song if that's all right. And we've got a bit of Wham and The Edge of Heaven, and then we'll
another one of my favourites.
Is this all the classics coming in? And we've got requests stacking up. So we'll if you put a request in, we'll play one of those shortly. You join me. It's Michael on my Saturday soundtrack here on Sheffield Hospital Radio. We're here all week, 24/7, just like Sarah and Chrissy, my guest from the A&E department, who do a fantastic job there. And we've had some fantastic reactions. I've never known that email and WhatsApp go like it. So thanks both. So let me just read out some of the fantastic stuff that we've got. So Steve has emailed in saying, can we send all our love to your team? You do a superb job looking after all of us when we need it, and hopes that everyone, and I'm sure that they do, appreciates the work that you do. So that's absolutely fantastic. Jane has emailed in. She says, well done to Chrissy and Sarah for going live. We're all tuned in. I think that's from the A&E team. I think that is amazing work you're both doing. We're so proud of the work that you do for our patients. So thank you, Jane, for that lovely message. And Mahmood, the chair, has messaged in and said again, can I do a shout out for our wonderful A&E team who are doing a great job for Sheffield and handling some fantastic care for our patients and handling the pressures that you do. So brilliant, really appreciative. So thank you.
Thank you.
How's it feel kind of getting some of that feedback from our listeners?
It's amazing, absolutely amazing. It's really good to hear.
Yeah, and it just puts everything into perspective, doesn't it? When things are busy and they're pressurised, and actually to hear that people do notice and can see the good work that all the team are trying to do. It makes my heart smile.
And I missed one, sorry, that said Chrissy is amazing. Now, Chrissy, this is an absolute credit to the NHS and STH. I've never known a more passionate and dedicated individual who gives it her all. Her projects are all self-led with minimal support, and she delivers each time. She has the most incredible rapport with our complex patient groups and always goes above and beyond to ensure their experience in ED and STH is a positive one. So credit there, Chrissy. So tell us about that. That refers to some of the work that you do, the projects, and one of the ones is for a particular kind of hard to reach group around homelessness. So tell us a bit about the work that you've been doing there, Chrissy.
So we started off in A&E and we was all bringing clothes in for the homelessness of Sheffield. We were getting quite a few last winter. So all the staff were bringing clothes in. And donations, and it just made me think, what can we do? What can we do to help these people? I got in touch with someone called Paulette. I don't know her surname, I'm sorry, but she runs the Duty to Refer programme for STH. So it does remain, so homelessness, it's significant health inequality within Sheffield, and many people experiencing homelessness do not routinely access primary care or preventative services. They often come to A&E in crisis and it's already too late for whatever's wrong with them. So I got in touch with Paulette to advertise Duty to Refer for all our nurses to start filling the forms in to help these kind of patients.
And that's referring on so they can access other services?
Yes, so Sheffield City, it goes straight through to Sheffield City Council. They pick the patient up and hopefully they get the help that they need, depending on how much they interact with the service, because a lot of them don't. I put into Sheffield Hospital Charities and got £5,000 funding. This is for a 3-year survival pack. So that'll give the homeless patient a jogger, a wash bag, a hat and gloves. We just run it over the winter periods. We're just waiting for the funding to come through now. Yeah, it's great.
And that must make such a difference to those patients, as you say, who don't always access primary care, so the GP, so I presume often find themselves in crisis when they come to you in A&E.
Yes, so we just like to give them that little bit of extra special care and make them feel welcome, treat them like everyone else.
That is amazing and fantastic, you said. And staff then helping themselves as well with donations of clothing and those kind of things for our patients.
Yes, and we do that religiously.
And so the grant from the charity, so you're waiting for that money to come through and that will then help you. Is that how the money will be used to buy those that kit for
I'll buy
individuals?
3 years worth and then just cut it into 3 years for the winter periods.
Yeah.
We'll have an audit trail of it so that people aren't just knocking on A&E's door. Just we want to get people involved. We want them to get the care that they need, that they deserve.
Yeah, that's absolutely fantastic. Well, that's brilliant. Well, that's amazing. So that's nearly the first hour over. I don't know about you. It's been fascinating listening to Sarah and Chrissy and some of the fantastic work that they do, both for our patients and the care that they give, but that holistic support for patients as well. So we've got more of that in the second hour, as well as any songs that you've requested. If you want to pick a song in the second hour, you can do. WhatsApp me 07900 339 429 or email studio@sheffieldhospitalradio.co.uk. I'd love to hear from you, or if you want to send on your well wishes to the A&E team and Sarah and Chrissy. We've read out some of those messages. That's been lovely to hear. We'd love to hear that. But for our final song in this first hour, taking us up to the news, I think, Sarah, this is one that your mum's asked for.
Yeah, this is a request from our Gillian, sat in her kitchen probably, in Ecclesfield. First time listening to hospital radio.
And what song is it? And do you know why she's picked this one?
It's Joe Jackson Stepping Out, and I have no idea.
Oh, well, what did you say your mum's name was, Sarah?
It's Gillian.
Well, Gillian, drop us a note, tell us why. Joe Jackson, Stepping Out. See you all after the news. So, in my second hour, I'm joined again by Sarah and Chrissy. Welcome both, and we're still getting some fantastic messages in saying it. We've had a message from Mr. Whiffo who says, amazing to hear Sarah and Chrissy. You're both such great role models for your nursing teams and provide care with a smile, which is absolutely fantastic. And then Sarah, your mum's messaged in. Thanks for that, Gillian. And she said she liked that song that we played, which was, I've forgotten what it was now. It was Joe Jackson, wasn't it? Stepping Out, Joe Jackson. And Gillian says it brings back lots of memories of when she used to dance in Josephine's nightclub before you were born, Sarah.
Many, many years ago then.
So absolutely. So yeah. So some lovely messages. And before the news, Chrissy, you were telling us about the amazing work that you've done for patients that arrive at A&E, ED, who are homeless, and for patients who have a hearing impairment. But you've also done some amazing work for patients that attend A&E with a learning disability. What's that involved?
So Josh put in for some funding, and we got special rooms for learning disabilities.
And Josh, sorry, who's Josh?
Josh is from ITU.
Okay.
And he put a bid in for rooms on AMU and rooms on ED for sensory rooms, which has been absolutely fantastic.
And tell us, so what's the sensory room involved? What's in that?
We've got a projector in there. We've got special lights on the wall which calm the patients down, or they can just turn them off, and it's just a quiet space. It is only one room. So obviously I've come up with a project to change that a little bit.
And so, sorry to cut across you, so tell us a bit about that room then. So you've created a room, it's a room within A&E, one of the cubicles, is it? Or
yes, it's Yellow 5. Yellow 5.
And which patients would go into that room? What would you use it for?
So anybody with a severe learning disability, non-communicative, needs a quiet space, we'd use that room for them. If there was another patient in there, we've got Yellow 4, which we don't use, so we'd look for the appropriate patient in Yellow that was fit to sit or waiting to go home, and put them in the Yellow 4 space. It is a pilot at the minute. It will be coming out very, very shortly. So we are piloting it, and we're hoping for feedback to bring it in to a policy so that we can...
That sounds brilliant. So that's the kind of an area, so when you've got patients with learning disability, or as you say, who need a bit of a quiet area, they go in there, that must be very calming then, a really calming area for them.
Yeah, so we noticed a couple of years ago that both ED and AMU, they are very chaotic spaces, and Josh Weaver is one of the project managers who leads on things around mental health, learning disabilities, and there, I think it was about 2 years ago now, there was where you could apply for sort of £50,000 worth of funding to improve patient care. So we worked with Josh and the learning disabilities team. Well, we basically asked them to help us provide some areas, utilising their knowledge and experience, to provide some sort of safe areas for patients. And these spaces are reflected on some rooms that they have at the Sheffield Children's Hospitals. And like Chrissy said, we've got projectors in there. There are special screens in there that provide therapeutic environments for patients. They got the money to be able to change these rooms around, but they are still spaces that can be utilised for other patients. But on the back of that was then education that Chrissy was able to do to help raise awareness around learning passports for our nurses, etc., which I think this has started a bit start of everything, and then you've been able to build upon, haven't you, the education side around the rest of your project.
And so tell us a bit about that then, Chrissy. What's that education been for your staff?
So I've fetched in a scheme called the Yellow Badge Scheme. So it's a yellow badge with a big smiley face. So obviously when the patient books in, again, this is not about labelling a patient. This is about what we're going to give to that patient with the badge, in, either on the carer or the patient. And what that gives is a quiet space, a quiet room. If Yellow 5's full, if someone's already in there, we can look for somewhere else. Obviously, we can't do it for every single patient that comes through the door. We have to assess their needs at that time. So this gets the nurses to read the hospital passport. It reminds them to read the hospital passport. We are very, very busy, but we need to read that hospital passport to deal with their needs.
And tell me about what's a hospital passport. Is that something every patient has, or patients with particular needs have?
Yes, so most patients with a learning disability have a hospital passport. It tells us, what they like to do, what they like to be called. It gives us loads of information, and it gets you interacting with the patient. And
so the badge kind of reminds staff to look at that, to follow that care plan.
Yes.
Oh, that's amazing.
Hopefully it makes the patient feel part of our team.
Yeah, absolutely.
Part of us, and we can interact with them and adapt our needs to their needs.
And you mentioned this was a pilot, so what do you mean by that? Are you kind of studying it? Is it only time limited? Where are you hoping it goes?
So I'm hoping that we get loads and loads of feedback, and then once we get the feedback, I can take it to the board in ED, and I'll be able to roll it out, and it'll be there.
Brilliant. And that's rolling out both the room and that yellow badge.
The room's already been rolled out. It's just a yellow badge scheme that I'm going to roll out, and the swapping of room 4 to room 5 to prioritise the patients.
Great. And you mentioned earlier when you were doing the hearing impaired work that you'd got a bit of a panel and you were getting feedback from patients. As part of the pilot, are you getting that feedback from patients as well?
I'm gathering the feedback already.
Yeah.
From the patients, and then we'll look at that together. Obviously, there's not only me on this project, there's Hannah, there's JJ, so 2 staff nurses, and Megan Rain, who was a support worker, and we're all in it together. We're all going to work together on it and get the feedback and sit at the table and decide what we're going to do.
It sounds, listening to you, Chrissy, like you're really kind of thoughtful and mindful of just how stressful an environment A&E can be for certain communities and certain types of patients, or patients presenting with other social and educational needs. It sounds like you're really kind of thinking about that and thinking how can they access services similar to other patients, make sure they don't get missed in the waiting room, make sure that time when they're in crisis, when they're needing healthcare, you're thinking about the whole person.
Yes, we are.
I mean, that's amazing.
And obviously the more staff we get involved, so when I'm not there, they can take over. Yeah. So we have, like to lead on it when I'm not there.
Yeah.
So it's really, really good.
And how's this going down in the rest of the department, Sarah? I mean, Chris is obviously kind of leading on this work, working with a team, but this, go back to what we said earlier, 24-hour service, 7 days a week. I presume this is being rolled out and all staff are taking Chris's lead on this?
Yeah, absolutely. So as a department, we get feedback from patients and relatives about their experience through friends and family testing, through feedback through the PALS team, and from written complaints. And sometimes we get really good feedback and sometimes not so good feedback. And one of the themes that we identified as a department was lack of awareness for patients coming through with learning disabilities, that staff weren't aware around the health passports and all about me booklets, and they weren't reading those and using those as tools. These patients that come through have complex needs, both physically and mentally, and quite often their carers, who are either their parents or people that work with them 24 hours a day, they fully understand those patients and how they need to be looked after, and we need to use those tools, what they're giving us, the health passport and the information, to be able to provide that care. And if we're not doing that, then we're not providing a quality service to those patients. So from that feedback, we've been able to help strengthen knowledge for the teams around the hospital passports, and just ensuring that the staff, even when it is busy, that they do use that vital piece of information, because it will say useful tools around how the patient, do they like to have the bloods taken, do they wear ear defenders. We have things like that we can provide for patients if they haven't brought them in, how they go to the toilet, what signs to look out for if they're in pain, if they're non-communicative, if they're hungry, because there is a massive problem for patients that have additional needs, where if you come into hospital, you are much more likely to either be sedated or restrained against because people don't understand your care, and we absolutely need to make sure that we're not doing those things where possible, and we're using the patient, we're using their carer, and we're using the hospital passport to give them the best care that they can do.
It's amazing just to hear. We said right at the top of the show that 350, 380 kind of patients coming through your doors every day. I'm hearing from you two, you're absolutely thinking about who are those patients, what are their needs beyond that physical presentation, and how do you give them the best possible care whilst they're under your care? Absolutely,
and I think what is important is that those patients do feel like an individual, and unfortunately, due to waiting times and sometimes slow flow, those patients can be in the department for quite some time. It's not like they're coming through sort of in and out within an hour. They can be in for quite a long period of time, and we absolutely don't want those patients or any patient to feel in distress or have things done to them we shouldn't be doing, and giving them the best possible treatment that we can do. So feedback is a gift. We absolutely want to hear the good and the bad around our department and what we have and we haven't done, so that we can continuously try to improve our services. And I think the work that Chris is doing to work with the wider MDT and then educate staff is just incredible, and it yeah, I could cry because it just makes me so happy.
It's amazing. It's fantastic and lovely to hear. So we have, though, got another request coming up, and I think this is from a member of your team asking for Toto and Africa. Who was this from, Sarah? Can you remember?
From our ED governance team.
And what do? They sound like an important team?
They absolutely make sure that we're doing everything right, in the right place, the right time, and that we're adhering to, obviously, all the hospital rules and regulations.
Fantastic. Well, here's for the A&E governance team. It's Toto with Africa. We're working up to the midday news now. It's me, Michael, on my Saturday soundcheck, and I'm joined by Sarah and Chrissy from A&E. And Sarah, you mentioned earlier just some of the work you've been doing around ensuring that patients, when they get to A&E, when they're going through A&E, that they wait as little time as possible, and you'd get them to their treatment as soon as possible. Tell me about some of the work you've been doing about onward flow and where patients go after A&E and how you reduce the waiting times there.
Yeah, absolutely. So when patients come through to A&E, obviously we want them to be treated in the most appropriate place for what they've come in with. And one of the big part of our jobs as a senior leadership team is to make sure that we're continually assessing the department and making sure that patients are in the right place. Obviously, as a trust, we're doing a lot of work around the flow throughout the hospital and all the different care groups working together. But within AEMP, we've been looking at what things we can do differently. We've sort of been taking that action this winter to work together as a care group. So within AEMP, we've got the ED department, we've got SDEC, which is same-day emergency care, we've got the minor injuries units, the DVT service, and an AMU, which is the acute medical unit ward. And things that we've been doing differently are in the morning, when we've been coming on duty, is assessing the patients that are in the department at that time, and actually, do they need to be within the actual emergency department. And what's been really good is actually utilising the skills of the nursing team. These are absolutely fantastic nurses who have got a wealth of knowledge and experience from ED and the acute medical unit to know where these patients need to be. So we go around as a team and are identifying patients that actually don't need to be there and could go to same-day emergency care, which would improve their waiting time within the department and for them to be seen quicker and discharged on the day. We also use an area on the acute medical unit which is called pit stops. So this is an additional sort of 6 to 8 chaired area, which we have no extra staffing for, but the fabulous AMU team have realised that we do need to, do more to create that early flow for when the ambulances start coming through. So we utilise that area to either pull patients through from the emergency department that are maybe waiting for a bed on the acute medical unit but don't necessarily need it just at that moment. They can still sit in a chair. They are quite ambulatory. Or for patients that we feel that are going to be discharged that day from the acute medical unit that could sit in that area and wait. So it's constantly, I feel like as a team, we're constantly looking, moving patients around, but informing them what we're doing and why we're doing it, which is obviously the most important thing, communicating with them so that they understand that maybe they are being moved into several areas, but it's about getting them in the right place and to be seen. And then what that does is it then creates a space within the emergency department so that when those ambulances do turn up, that we can we've got space and capacity to take those extremely unwell patients and release those ambulance crews to go back out into the community again to be back seeing those patients that have got either life-threatening illnesses or life-threatening accidents that need that ambulance crew. So it's not something that we're just doing once a day. We are continually assessing. Chrissy, as the senior sister or the nurses in charge, they will be going round. Again, we've got an area within A&E which is called the Clinical Decisions Unit, which we can move patients round from our majors areas that maybe don't necessarily need to be on a trolley, could be fit to sit. So I do feel like we spend a lot of time making sure that the patients are in the right place.
And I've not appreciated, so we kind of all think of A&E, accident and emergency, we kind of see it on TV, on casualty and things like that as that department, but from what you're describing there, so many different areas, same day emergency care, minor injuries unit, GP collaborative, I'm trying to remember them all, acute medical unit.
Yeah.
I've kind of got this vision of you as almost like air traffic controllers, kind of clinically coordinating. Would that be fair? Each patient, getting them into the right place, thinking about who's coming. I mean, that sounds like amazing work that you do.
Absolutely, and it's a full team effort. The minor injuries is led by the EMP team, which provide an absolutely fabulous service. ESTE, clinician led, but also ACP led, nurse led, and these are all areas that are, led by teams of people that want patients to be seen in the right place, and if they don't need to be in hospital, to get them home on that same day. The acute medical team to be utilising pit stop. I mean, AMU is I used to be the matron for there, so I do have a lot of love for that area. But it's a 56-bedded unit. It's one of the biggest in the country, and for them to be having another additional 8 patients 24 hours a day with the same staffing ratio is absolutely incredible. And they're constantly thinking, the nursing team on there, about what else they can do to provide that flow for patients so that they are getting the right treatment and are all laid in the right areas. So it's fantastic.
Yeah, it's brilliant to hear you describe it with such passion and kind of patient-centeredness. And one of the messages we've had in, I don't know if this is someone you know, Amy's message says, hello from Rupert the Pat Dog. Lovely to hear from a couple of the amazing staff from our most visited department of A&E. We visit regularly and see fantastic work happening from all involved. Great job, team. Is that Amy and the Pat Dog? That's someone you see regularly?
Absolutely. We love Rupert. We love Amy as well, obviously. But yeah, it's and one of the things that's really nice is when Amy brings Rupert round, it's a nice thing for the staff to go and have a little cuddle with Rupert the dog.
Well, I don't know about you, but I don't know where this morning's gone. It's been absolutely fascinating and enlightening listening to Sarah and Chrissy. Thank you so much for being a guest. It's been fantastic to hear about the individual projects that you've done, Chrissy, for some of our really most vulnerable patients, and then to hear about the work on flow. But clearly the job that you two do as leaders of such a fantastic team in A&E. So thank you.
Thank you so much for having us. We've really appreciated being able to come and share our stories and try and raise the awareness of what we do within the department. I think it's been such an amazing opportunity, so thank you.
I second all what Sarah's just said. Thank you very much.
But thank you, Cicely, to the work that you've done. I mean, we talked right at the beginning about some of the challenges of working in A&E, but listening to you two, it sounds like you're such a close-knit team and absolutely patient-focused. So just, do you want to say anything to your team out there?
I think I would really like to just say, I mean, I always like to thank them every time I'm on, and they probably get sick of all my gushing emails that I send out to them and my words of praise, but I feel so proud and lucky to be the matron of that department. I feel so grateful for the work that my team do every day. They turn up, they give it 100%, and they work really, really hard, and we don't always get it right. But what we do is we try to do our best, and we try to learn from things that may have not gone so well, and we ultimately the patient's at the heart of everything that we do.
No, that comes across in it. And Chrissy, I think you're hot-footing it to the northern now. I don't want to make you late for your shift. You're working till midnight tonight.
Absolutely. I can't wait to get there.
Brilliant. Well, I'll not hold you up. Thank you, seriously, for taking the time this morning and for everything that you do across Sheffield Teaching Hospitals in our A&E department. It's been absolutely lovely to have you on. So thank you.